anesthesiologist and intensivist in Shankara Cancer Hospital and Research Center. Cancer is a major health problem not only in India but all over the world. And we know that the journey of a cancer patient, right from the detection of cancer to the end of treatment, which may include surgery, chemotherapy, and radiotherapy, is fraught with a lot of pain, anxiety, and fear. Anesthesiologists are specialists in administering anesthesia for surgeries, but the role of anesthesiologist does not end there. Most of the anesthesiologists work outside the operation theatre too, in helping the patients right from the diagnosis of cancer to the end of their treatment. These anesthesiologists who are practicing Onco Anaesthesia, that is a specialized group of patients who are being treated for cancer, in these patients the anesthesiologists have a separate role and hence they are called as Onco Anaesthesiologists. Onco Anaesthesia is a recent addition to the subspecialty of anesthesiology, and it has started about 7 to 10 years from now, and it is growing rapidly as a subspecialty of anesthesiology. The role of an onco anesthesiologist is to be a silent companion to the patient right from the diagnosis of the patient, from the diagnosis of malignancy up to the end of the treatment. During the diagnosis of a patient, the role of an anesthesiologist is to provide pain relief during certain procedures like biopsy, in which case he might give a local anesthesia, or in case of detecting central nervous system malignancies by doing intrathecal punctures or lumbar punctures, and helping in also patients who are undergoing procedures like bone marrow aspiration or CT guided biopsy. In all these areas, an anesthesiologist may provide his services to reduce the pain and anxiety of the patient. During chemotherapy, an anesthesiologist may be asked to insert a wide bore cannula or a PICC line or a central venous catheter or a chemoport in a patient so that it facilitates the easy administration of chemotherapeutic drugs. He may also be asked to do intrathecal or lumbar punctures in order to draw the CSF for cytology, or also administer medications into the spinal space to reduce the spread of malignancy into the central nervous system. In radiotherapy, the anesthesiologist may be called for several procedures. He may be called to give anesthesia for patients who are receiving brachytherapy, in which case needles will be inserted into the part which needs to be irradiated. It may be the breast, it may be the cervix, tongue, or prostate. In this case, he will have to administer a full anesthesia for the patient for this procedure to go on smoothly. He may be also called to the radiotherapy suite in order to anesthetize patients, especially those who are agitated or restless, and also in pediatric patients for them to make them lie down calmly and quietly. This is the role in radiotherapy. During surgery, the role of an anesthesiologist is obvious. It is to administer anesthesia for the patient who is undergoing surgery. But the anesthesiologist also prepares the patient for surgery by taking care of their previous comorbidities and also by prehabilitating them by administering nutritional supplements or giving them certain exercises to enhance their functional capacity. For this, the anesthesiologist is known as a perioperative physician. Perioperative means all around the surgical procedure. The onco anesthesiologist is special in the way because he knows the entire treatment history of the patient, what sort of chemotherapy the patient has received, what radiotherapy the patient has received, and what other sorts of treatments the patient has received. It is important for an onco anesthesiologist to know the history of the patient and the drugs which the patient has received, because most of these drugs have some or the other form of side effects and adverse effects. Like certain chemotherapeutic drugs may be harmful to the heart, some of them may affect the kidneys, and some may affect the bones and the bone marrow. So it is important for the onco anesthesiologist to know about all these details so that he can administer anesthesia to these patients in a safe and comfortable way. During the surgery, the onco anesthesiologist is involved in taking care of the patient's hemodynamics, that is his blood pressure, heart rate, urine output, temperature, etc. And after the surgery, the onco anesthesiologist is taking care of the patient in the post-operative ward or in the surgical ICU. Here, he also takes care of the patient's pain control and pain management, and also in addition, he takes care of the patient's nutrition, fluid management, hemodynamics, etc. The other role of the onco anesthesiologist is in the intensive care unit. When the patient's general condition deteriorates, or if the patient becomes bad due to either any infection or worsening of the cancer or any other illness, acute condition like breathlessness or cardiac problems, the patients are shifted to the ICU. Here again the onco anesthesiologist is called because of his expertise in handling infection, expertise in handling sepsis, his proficiency in handling the ventilators and hemodynamic monitoring, and also because of his knowledge of the patient's entire history of chemotherapy and radiotherapy. The onco anesthesiologist is well prepared to take care of these patients in the critical care unit. In patients with later stages of cancer, once they are gone beyond the period where they can be treated curatively, in such patients, when they develop complications or when their general condition goes down, they are referred to the palliative care, that is the pain and palliative care medicine. Here again, the onco anesthesiologist is involved in taking care of these patients by managing their pain, by administering higher narcotics, opioids and medications, by titrating these medications to their pain levels. And he is also proficient in giving nerve blocks and ganglion blocks, which will to some extent mitigate the pain to a great level. Once the patient is advanced in malignancy, they will also require certain form of care in order to improve their quality of life to some extent. They may be beyond cure, but in order to improve their quality of life, onco anesthesiologists may be called to either administer oxygen or to reduce their anxiety, and also to take care of their hemodynamic parameters and other issues which are causing trouble to them or causing discomfort to these patients. Finally, as the patient reaches the end of life care, at that point of time also the palliative care physician, who may be an onco anesthesiologist, is called, and several times the patient would like to be treated at home. So in such patients, a domiciliary care is provided by the pain and palliative care team. Here again, the patient's quality of life is taken care of. The patient may be administered nutrition or oxygen at home. The patient may be given certain pain relieving medications or sedatives to keep the patient calm and quiet and take care of him and give solace to him till the end of his journey. On this day, I take the opportunity to wish all anesthesiologists a very, very happy World Anesthesiology Day. Thank you.